Hi everyone, welcome to the Glow Podcast. I am here today with a very exciting guest. I have Lisa from Giffen Aesthetics in LA, and I'm super excited to talk to her about some very interesting topics. But before we get started, if you are new here, we are Tailored Marketing and we help aesthetic clinics and skincare clinics grow their businesses through strategic marketing strategies. So if you're interested, drop a comment below. Lisa, I'm so excited to have you here and talk all things aesthetics, and we're going to talk about some lasers and really, really fun things today. But if you would, I would love if you would introduce yourself so my listeners know who you are.
Yeah, definitely. Thank you for having me. My name is Lisa Giffen. I am a family nurse practitioner and I am owner of Giffen Aesthetics.
Amazing. Yeah, I'm super, super excited to have you here. Can you I know right now, one of the big things that you have at your practice is the Alma Hybrid laser. And so I would love for you to kind of briefly explain what that is and how it differs from traditional laser technologies.
Yes, definitely. So it's a hybrid. It's a laser. But this laser has a duality to it, which is amazing. We have two lasers, and I like to explain it like we have a sandwich. One resurfaces the dermis layer. It goes underneath the skin, so there's no downtime with that laser. And then one is going to resurface the epidermis, the top layer of the skin. And so you're getting a duality with this laser where it's really resurfacing the skin in two different areas, and you get exponential results. And the best thing about it is the downtime has shifted. It's no longer like a month to a month and a half. We have a downtime of 1 week to a week and a half if you want to be aggressive. If you want to be less aggressive, we have like very, very little downtime. So there's just so many different options with this laser compared to other lasers.
That's super, super cool. Yeah, and I feel like during the summer, sometimes it's like a little bit harder to do some of the lasers because, obviously you can't be in the sun and it's very sunny during the summertime. So is this something you could do during the summer too, and just have like you said, that downtime of like maybe a week or so, and then you can be back out in the sun and fine?
Yeah, exactly. We actually have a red carpet glow setup on this device, and that downtime is like 1 to 2 days. So it's just going to brighten, tighten, and you can be out in the sun.
That's awesome. Yeah, I love lasers because they're so much less invasive than like other things that could potentially do the same thing. So that's really, really cool. And so what kind of inspired you to bring this new technology into your practice? Like, how did you hear about it, and why were you like, oh, like I have to have this?
Okay, yeah. I have been in love with lasers for so long. I have been working with them for a while. And I'm the type of personality, if I do something, I have to do it like the right best of the best way.
Yeah.
And this laser is just it's the best. Like the patients are just so happy with the results. The results just speak for their own. I don't even have to speak about it, but it just gives you so much more options and the skin just starts glowing and everybody is just obsessed with it. So yeah, I had to
Yeah.
have them in practice.
You're like, I saw it and I knew it was the one.
It was the one. Yeah, it was the dress fit. Yeah, exactly.
That's awesome. And so what you said that it mainly does like tightening and lifting for the face.
It's gonna do everything. So it's gonna skin laxity, hyperpigmentation, melasma, fine lines and wrinkles, scarring, stretch marks. This laser can do everything in like the top notch. Not just like it's not like it just doesn't do a mediocre, it does it in the best way.
That's awesome. Super, super cool. And the Alma Hybrid combines both ablative and non-ablative wavelengths. Can you kind of explain the benefit of this dual approach?
Yeah, the dual approach, you're just gonna get, more bang for your buck. You're gonna get better results. So, like I said earlier, it's we take this laser head right here, and it has the 1570. It goes to the dermis layer, and it resurfaces inside out. So with that laser, you have like no downtime, and then it resurfaces the top epidermis layer. So your skin is extra working, and whenever we create a purposeful injury to the skin, when it heals, it creates collagen and elastin.
Okay, cool.
So you're getting double the amount of collagen, double the amount of elastin.
That's awesome. And so, can this laser be used on all skin types and tones as well, or is there any limitations?
No, all skin types, which is very unheard of for lasers. This laser can be used on
Yeah.
all skin types, darker skin tones. They're getting great results, getting just as great as dewy skin, and we can be almost as aggressive. So it's really cool.
That is super, super cool. And how many sessions are typically required for patients to see results? Can you see results after the first session?
Yeah, definitely. You're going to see results after the first session. I like to give the analogy of it's like going to the gym. The more consistent you are with the laser, the less you have to like work harder later.
Yeah.
Depending on how aggressive or how much downtime, not even aggressive, how much downtime a patient wants to have with the laser, they can either do it once a month if they want like less downtime, or they can do it once or twice a year.
Okay. Yeah. So there's lots of different options kind of with
So many
treatment
options.
plans.
Yeah, yeah.
We love that. We love an option because I feel like a lot of times people are like, okay, I don't know if I want to have to come back like every single month, but like maybe I can do it like once every like 3 months or, whatever.
Perfect. Yeah, we can just totally tailor it to however you, no pun intended, however you want it done. Yeah.
Yeah, no, that's awesome. And so what can patients expect during and after a treatment session? I know you talked about obviously like the limited downtime, but during the actual session, can they feel like is there like any
Yeah.
pain or anything like that?
I wouldn't say it's painful, but she's spicy. She's a spicy
Yeah.
mom. So you're gonna feel a little bit of heat, spiciness, and it's a little uncomfortable, not bad. Again, depending on like I had a patient yesterday, she was like, I want the most aggressive. And I was like, all right,
Yeah.
I'm doing it. And so it was, more spicy. That's like
Yeah.
I want extra hot spice.
Yeah.
Somebody that is like, you know what, it's my first time with lasers. I'm afraid. I'm scared. We go lighter. And they're like, oh my gosh, that was like nothing.
Yeah.
Still both get great results. So that's that. And then afterwards, so we tell you not to put anything on your skin other than our solutions at the office if you choose to go that route. Don't touch your skin for 24 hours. And then after that, your skin is going to develop like a little sandpaper texture. It's going to feel funny and it starts exfoliating or peeling and develops like a little bit of a scab, and it naturally comes off on its own in the next few days. And that's when
Yeah.
you really get the resurfacing.
Yeah, no, that's super super cool. That's so funny how you were talking about it's spicy. It like reminds me of when you go to like an Asian food restaurant and they're like, "Okay, like on a scale of 1 to 5, like what do you want?" It's almost like it can do as much as you want it to do. If you want like a little bit less and like you're more timid coming into the treatment, then you can kind of bring it down a notch a little bit. Or if they're like, all right, the last time like I didn't even feel a thing, like let's go all the way. Yeah, no, that's super super cool. And then are there any side effects or risks that patients should be aware of when using it beforehand?
Yeah, I mean, there can always be side effects and risks. It also depends on if you're listening to the post-op care, which is like staying out of the sun. Um,
Yeah.
you can, I mean, I live in sunny California, Southern California, so there's sun everywhere, and that's okay. But like, are you putting on your hat? Are you putting on sunscreen? Are you, you can't just like go and do a laser and then like go lay out in the sun
Yeah.
afterwards. If you do those things, you can have a risk of like hyperpigmentation. So
Yeah.
where if we want it to get lighter, it actually gets darker. However, we haven't had those issues in our practice.
Yeah, as long as you follow the instructions that you're giving them, then it's like,
Yeah,
okay, we're gonna be good.
yeah, it's good. And like, yeah, it's great. It's great.
Yeah, no, that's awesome. And how soon do patients typically begin to notice improvements in their skin after, like, say it's their first treatment? How soon can they kind of be like, okay, this is what I was wanting from the treatment?
I would say about 5 to 7 days after the treatment, they're gonna be like, whoa.
Yeah. No, and that's quick, honestly, too. Because, like, sometimes with stuff, I mean, you can obviously, like, with fillers, injectables, you can kind of notice almost immediately. But, like, 5 to 7 days for a laser is really, really quick.
I know. It's amazing. It's unheard of actually.
Yeah. And what kind of long-term results can be expected with proper care and maintenance?
Long-term goals are going to be like you're just gonna have really good skin health. You're gonna age gracefully, and you are just gonna look good for your age. And people are gonna be like, "Oh my gosh, what are you doing? What's going on?" Get that kind of results.
Yeah. And what other treatments, I guess, can people combine for enhanced results with you at your practice?
So with the laser, we can combine other treatments such as like Botox or filler. We can do those on the same day. I wouldn't do any other lasers with it or skin resurfacing techniques with the laser because she is spicy and she covers that whole area. We can
Yeah.
also combine what I love to do with it is like exosomes. They're derived from
Yeah.
adipose tissue stem cells. You do the exosomes with the laser, it's game changer, game over. It's
Yeah.
amazing.
Yeah, and so for anyone who's like unfamiliar with exosomes, could you kind of explain just a little bit more? Because I mean, obviously they've been around for forever, but I feel like people starting to use them is not new, but fairly new.
Yes, exactly. 100%. So exosomes are derived from adipose tissue stem cells. They're donated from people that want to donate their stem cells. And they do cell to cell communication. They transport protein, RNA, DNA, and they're going to catalyze the results. They're going to help you recover faster and sooner, and they're going to increase your collagen and increase your elastin. So they are just huge right now in biohacking, aesthetics, and wellness.
Yeah. No, that's awesome. And so the one that you use is a topical exosome cream then?
Yeah, so with the laser specifically, we're going to use a topical exosome, and it's going to stay
Okay.
in your skin for 24 hours afterwards. So after we do the laser, we put it on there, and then it stays on there for 24 hours, and it really seeps into the skin.
That's awesome. Yeah, I love exosomes. I feel like there's so many like
They're
possibilities
so
with
fun.
them. Like I love like the bio part of aesthetics and really wellness that's like starting to come into it, and I think there's like I said just so many possibilities with what we'll be able to do with them in the future and lots of research going on, so it's exciting.
Very fun. They're so fun.
And so, from a provider standpoint, how has the Alma Hybrid improved treatment outcomes or even workflow efficiency for you?
We're seeing more patients in the office, thankfully, because of the laser. Like, it's just so popular. And especially in Southern California, I mean, we're the like epitome, I think, of like where aesthetics is. We
Yeah.
just, well, like, are like, this is the best laser. I want it. I want it. I want it. So we're seeing that the results are like speaking from themselves. And then patients are just like, I have like people text me, they're like, oh my gosh, they said, thank you so, so, so much. My skin looks so well. So it's just improved the entire practice all around. And patients' results are just, they're just so happy with it.
Yeah, no, for sure. And so, is it hard to find this laser right now? Like, do a lot of practices have them or are they fairly new?
This hybrid laser is fairly new.
Yeah.
I wouldn't say she's rare. Yeah,
Yeah.
because she's the newest of the bunch. We took all the other lasers and then we were like, oh my gosh, we did it wrong. Not like we did it wrong, but this is how we can do it better. Yeah.
Yeah. No, and like, you're always looking for improvement with the practice and like what is the latest greatest that's kind of out there. And so it sounds like yeah, that's definitely what it is for sure. And how has patient feedback been since implementing the Alma Hybrid in your clinic? Like, what are your patients saying? It sounds like they're all very, very satisfied with the treatment. So, what is their like specific feedback, or maybe even like a story of someone, with like their confidence or whatever?
Yes, definitely. I mean, we are getting, so our patient feedback has been phenomenal. No joke, no exaggeration. I had a patient and she has allowed me to speak about it, but she had deep pitted acne scars. She had acne, cystic acne growing up, and just she felt so insecure with the scars on her cheeks. And she had tried traditional CO2 lasers, she's tried everything, and her self-esteem was really down from these scars all
Of
over her.
course.
And I was like, she was like wanting to do a different treatment. I said, no, let's do the Alma Hybrid. If you don't like it, I'll bring you back in. She is like, she's the one that's texting me like, oh my gosh, Lisa, thank you so, so, so much. Like the acne scars are like 70% better. They're so
Yeah.
much better. And yeah, yeah. So we're just getting phenomenal results.
No, and I think that that speaks so much to the versatility too of it.
Yeah.
Like you can use it for acne scarring, you can use it for like tightening, like you said, hyperpigmentation, but like that. I feel like, especially acne scarring, because like I know people even in my personal life who have dealt with that, and like you don't have the acne anymore, obviously, but if you have had like cystic acne, then you're still gonna have the scarring from it. And it's almost like every time you look in the mirror, it's like a reminder, kind
It's
of like, yeah, it is. It really is. Cause like, it's just, yeah, I feel like that's something very, very hard to deal with. So I really think that that speaks to, like I said, the versatility of the tool. Like, it can do everything.
literally everything, literally, and more than everything.
Yeah. And what sets Alma Lasers apart as a company in your experience? Like, how has it been working with the actual company and everything?
So Alma lasers, in my experience, when I came to California, the top practices were always using Alma lasers. And they set apart, in my personal opinion, the science, the technology, and the physics of their lasers are just so above par.
Yeah. I guess, and like what makes it different with like the technology compared to like maybe other lasers that you've had in the practice.
Yeah, they're just the energy that's used is more efficient, so you get better results. And
Yeah.
the devices are just the best.
Yeah. No, that's awesome. That's super, super cool. And what should a potential patient looking for when choosing a provider for treatments? Like what should whoever would, maybe if they're like in LA or whatever area that they're in, when they're looking for a provider, what kind of specific things do you think patients should be looking at?
So, what I personally think patients should be looking at for a provider for lasers is like what's their experience, how long have they been doing it, how were they trained, do your due diligence on the provider and make sure that they have experience because lasers, we can have side effects, like I said, like the hyperpigmentation. You can burn somebody. They're no joke, but used in the
Yeah.
correct way, they are the most fantastic thing for skin health and skin care. So I would say do your due diligence, make sure you read reviews and check out and ask your practitioner some questions before you get the laser done to make sure that they have the right knowledge and training
Yeah.
behind the laser.
Yeah, no, and I think you brought up such a good point. I feel like reviews are so helpful. Or even like going to like their social media pages. I mean, I know they're the one like you would be the one curating your social media feed, but I do feel like you can tell a lot about the practice just from like a social media feed. You can kind of even tell like am I gonna like because if you're going to like an aesthetic clinic, you're typically gonna be going more than once a year, so like you're gonna see them more than your doctor. So it's like make sure it's somebody that you're gonna like jive with too, that you want to be sitting in the chair with for like 30 minutes or maybe even longer, and talking to. It's like almost like your hairstylist.
Yeah, I always say too, like judge your injector or your site provider by how they look. That
Yeah.
whole don't judge a book by its cover, that's thrown out when it comes to like aesthetics because if you're around somebody who's like overfilled, they probably are heavier with the filler, you
Yeah.
know? So yeah, that's another little piece of advice I would say too.
It's just like that's not necessarily what I'm like looking for when I'm going.
Exactly. Yes, you want to choose somebody that you feel that that's your look because that's
Yeah.
probably how they inject and how they do their treatments as well.
Yeah, no, for sure. And I think, yeah, like you said too, bringing up reviews, like that's a great way to kind of get a gauge of like, okay, what are people's experiences? And you can even filter, for keywords like, okay, who's used like the Alma laser.
Yeah, definitely. Definitely.
And where can patients go to learn more or book a consultation with you or with Giffen Aesthetics?
So patients can go for Giffen Aesthetics to learn more or book a consultation. We have an amazing, nice website. It breaks it all down on there and gives very in-depth information. And then we have a booking link on there or on my Instagram or TikTok.
Awesome. And then do you have kind of any final thoughts on the future of laser skin treatments and how Alma Hybrid fits into that vision?
Yeah, so for future treatments, I mean, I think hybrid lasers we're going to be seeing a lot more of them, the duality, because we're getting double for one procedure. And I just think that Alma's going to keep coming out with better and better lasers, which is just super exciting.
That is super exciting. And so, kind of moving over to a new topic, for those that aren't kind of familiar, and we kind of talked about it a little bit earlier with the exosomes, but
Yeah.
for those people who are new to the concept, how would you kind of define biohacking and kind of how is it making its way into the aesthetics industry right now?
Yeah, so I would define biohacking as living your optimal, highest quality, best life at any stage in your life. So, and the way that it is making its way into aesthetics is that it's all over the place right now. Aesthetics is really turning into wellness. It's not just fillers and Botox anymore. We're really anti-aging from a practitioner point inside. We're seeing what causes the person to age faster and age like more aggressive, and we're really
Yeah.
focusing on changing that from the inside, and it's coming out to the outside. So aesthetics is really turning into wellness.
Yeah, I think so too. I mean, I think that like a lot of people now are more focused on like, okay, I want to look good. You know, who doesn't want to look good?
Yeah,
But like,
right.
I also want to feel good too. And like, I think those things are so correlated together. Like, if we're doing well internally, then we're gonna look a lot better on the outside as well. And I mean, it makes sense, you know, like.
Yeah, when you feel good, you look good. It's very simple. Yeah, so we're really getting into like it not just being an outward thing, it's really now an inward thing.
Yeah, no, that's awesome. And so I know there are many types kind of biohacking. We have nutrition, technology, genetics. What areas do you focus on the most? I guess personally and also within your practice, and why?
Yeah, definitely. So what areas do I like to focus on as a practitioner for biohacking? And I always start with labs. Labs, we like to go inside again. We're going
Yeah.
inward with the patients, inward with ourselves. And the labs will tell us a lot about a patient. And we don't want to just hit normal levels anymore. That's not acceptable. We want to hit optimal levels. So optimal with your vitamin D, just optimal levels so that you are feeling optimal yourself. So that's like one part I would say we look at like the Giffen aesthetics myself. I look at the genetics. And then we also really focus on, having, I think as we get older, just energy levels. Like it just,
Yeah.
we're depleted. So again, feeling your best. Like you want good energy, but not like a stimulant energy where you're going to go up and crash. We want like a nice maintained energy and just mental clarity.
Yeah. No, for sure. I think that that's so important, especially I mean, with both women and men, like a lot of our hormones and stuff, like they go down as we get older. And with that, like our energy levels go down too.
Yes.
And
Yeah.
it's like, I've known people even who have like started taking hormones or like maybe even supplements. Like, there's so many kind of like different options, like based on, like you said, your lab work. That's the first step. It's like, okay, let's see where you're at so we can get you back to this optimal place. But I've seen so many people who like have started doing something to get back to those energy levels, and then they do, and they're just like, my gosh, like I have like my life back, like I have myself back, you know. And it's really cool to see that, especially like with people who are maybe close to you, or like even I'm sure with your patients, like being able to see them get back to that place is really.
Yeah, it's the best feeling for me is when like somebody's like, "Oh my gosh, Lisa, thank you so much. I feel so good." Like it makes me feel so good.
Yeah, no, definitely. And what are some simple, safe biohacks that beginners can implement right away? Like things that people can kind of do at home without maybe having to like get blood work done or anything like that.
I would say like the simple things that you can do at home for biohacking without having to go into like a practitioner's office, or you just want to like start off are like supplements. They're
Yeah.
great. There's like five different types, many different types of magnesium. It can help you sleep and like relax your muscles. So get on some of that. Like NMN, if you are not ready for NAD yet, you can take NMN, which is a capsule form. So I would just say, getting into the supplements and boosting that, and like nutrition, like bone broth and other things like that that can just really step your game up in that.
Yeah, no, I think that that's good. And what wearables or tech tools do you find most effective or game changing? Like for with biohacking, people are trying to keep track of these things. Obviously, there's so many out there. You know, you have Apple Watch, Whoop, Fitbit, you know, all of the Aura Ring. I'm trying to think of like all of the different kind of like wearables that I know of. At least like those are mainly like fitness based. Some of them are a little bit, but do you have any ones that you recommend to people?
So I personally, I had an Apple Watch, love it. Part of my biohacking journey is like to disconnect from, and connect to myself a little bit more. So I don't have any of those technologies, but what I do love, which is a technology, is red light therapy. It's a game changer.
Yeah.
You're gonna change your skin as well as your mood. It's just huge, and I think it's very understated in the biohacking world.
Yeah, no, I think, yeah, I love red light therapy. I have like one of like the portable ones that you can use. And then like I also go to like the infrared sauna and stuff too. But I think that it's one of my favorite things, to be honest, too. It like, I find what it helps with the most for me personally. Obviously, there's so many different things, but I found with me personally, it's like sleep and inflammation.
Yes, isn't that amazing?
Yeah, that's like what I noticed the difference in. Like if I've gone or if I've used like my red light blanket, then like I can notice such a difference in like those two things. Like just like if I do it that day, then it's better.
Yes, it's amazing. Like I love red light. Do red light more.
No, for sure. And how do you kind of evaluate whether a biohacking technique is safe or evidence-based? Because obviously there are so many different things out there. A lot of people are hopping on this trend, and it is kind of hard in the world to be like, okay, I don't have time to research everything.
It is really hard. Yeah, definitely. How is something safe in the biohacking world? Well, I mean, I would use a provider, that's knowledgeable with biohacking rather than like DIY or do it yourself. And biohacking is a little bit of a gray area. Biohacking is like a free spirited practice. So we are off the beaten path a little bit. And this is like new and upcoming changing medication and practices. So I would say definitely working with a provider, number one, to keep it safe and starting off simple and slow with things.
Yeah, no, for sure. I completely agree with you. And what biohacks have had the biggest impact on your physical performance, mental clarity, or longevity? Also, maybe even things that you've seen with patients as well.
Definitely. So, what have I noticed with patients or myself with longevity and mental clarity? Right now, it's huge in biohacking. It's called methylene blue, and we do suggest that you get it from like a medical grade so that it's not just bought somewhere, because it can have those type of supplements can have like things in it that we don't want. But methylene blue has totally improved my mental clarity and my cognition and just focus as well as mood. I'm really big on low dose naltrexone. It's huge right now. And has been for a while, but it's like really starting to like resurface. That's given me so much energy, but a really clean, natural energy. And then I would say NAD. It's just gonna improve your mood, boost your like clarity like crazy, and anti-age your cells from within, literally.
Yeah, no, that's awesome. And so what do you think kind of is on, I guess, like the horizon for the future with biohacking? Like where do you see it headed, and what does kind of like the future look like?
Yeah, with biohacking in the future, I mean, I just think that aging just got really fun. We're gonna get fun to get old. And we're gonna have a lot of fun with it because of biohacking. So just better quality of life. It's not about like how long you live. I think it's how great you're living. So are you able to bend down, grab things? What's your energy like around your friends and family? So I think just aging got really cool.
Yeah, no, I completely agree with you. And what's one of the most surprising things you've learned through your own biohacking journey?
What is one of the things that I have learned the most through my biohacking experience? I just think like for me personally, like it just feels really good to be in my late 30s. I feel better. I have more energy than I did in my teen years.
Yeah.
I have more mental clarity. It's just I feel so good. Like I'm so
Yeah.
happy when I wake up. I feel so good, and it's definitely due to like it's a like eating well, the whole biohacking thing. But yeah, I just feel great. I
Yeah.
just feel great. That's the best feeling.
No, that's awesome. Well, tell all of my listeners where's the best place to find you online, where's the best place to connect with you. I'll also put it in the show notes too for easy access.
Okay, great. Yeah, so you can find me on Instagram. My handle is at Giffen Aesthetics, or online, my website is www.giffenaesthetics.com.
Awesome. Thank you so, so much for coming
Thank
on. I
you.
really, really appreciate it.
Yeah, it was so much fun. Thank you so much.